Hi Nancy, my name is Scout Marson and I will be your doctor for today. I understand that you came into the hospital because you were experiencing dripping of your face, difficulty raising your right arm, and difficulty with speech. Is that correct?
That's correct.
Okay. So what you have experienced is called a stroke, which is a blockage or disruption that prevents blood from getting to the brain. The specific type of stroke that you had is called an ischemic stroke, which is the most common, and it is when the arteries that supply blood to the brain is blocked, so the blood cannot get to the brain. What questions do you have about this?
I'd like to make sure that I understand this correctly. What you're saying is that the diagnosis that you're offering is a stroke based on the symptoms that I have given to you, and what seems to have caused that was a blockage of the blood flow, which therefore prevented oxygen from getting to the necessary parts.
That's correct.
Okay, I understand.
Okay. So, do you have any other questions about this?
No, not at this time.
Okay. So from this point, I'm going to recommend 3 actions that you can take in order to help your recovery. So the first action is to take some prescription medications. So the first prescription medication is 5 milligrams of oral lisinopril, which is going to lower your blood pressure and keep it within a normal range. Another prescription that you need to take is atorvastatin at 40 milligrams, which will help to lower your cholesterol. And then you need to take 300 milligrams of aspirin, which will work as a blood thinner. The second action that I'm going to recommend for you is to set up appointments with occupational and physical therapy. Seeing these professionals will help you to improve the use of your right arm, which you mentioned that has been difficult. I am going to refer you to physical and occupational therapy, and you just need to stop by at the front desk to set up these appointments when you leave.
Okay.
The third action that I'm going to recommend for you to take is to change your diet to include more healthy foods. So this includes using 5 to 7 servings of fruits and vegetables a day, having 2 to 4 servings of whole grain per day, and 2 small servings of lean protein a day. So by taking all of these steps, this is important because it will help to reduce the risk of having another stroke. It is more likely to have another stroke once you've already had one. So by taking these medications, going through the therapies, and modifying your diet, you will have a decreased risk of having another stroke. So what questions do you have about this?
I just want to make sure that I understand. So what you're saying is that you want me to go on 3 different medications plus an aspirin, and you also want me to see a physical and occupational therapist to help with the movement in my arm, and then I should also change my diet to help prevent this from happening again.
Okay, yes. So all of that is correct. And before I leave, I just want to go over a few more things just to make sure that you understand it. So you mentioned that you'll be needing to take medications. Do you remember what medications those are? Can you repeat those back to me?
The actual names of them?
Yes.
No.
Okay, so I will tell you again. So it is 5 milligrams of oral lisinopril, and it is 40 milligrams of atorvastatin, and 300 milligrams of aspirin.
Okay.
Can you repeat that back to me?
Aspirin,
Yes.
lisinopril,
Atorvastatin at 40 milligrams.
atorvastatin, and
5 milligrams of oral lisinopril.
and 5 milligrams of oral lisinopril.
Very good.
Okay.
So I think that you got it. And the second action that you mentioned was doing the physical and occupational therapy. Do you remember how to set that up? Could you repeat that back to me?
I need to stop at the front desk and have them help me set it up.
That is correct. And then with modifying your diet, can you repeat back to me what servings you need to have per day?
2 of lean protein, 5 to 7 of fruits and vegetables, and 2 to 3 whole grain.
Very close. So it is 2 to 4 small servings of whole grain.
2 to 4.
Do you mind repeating those back to me?
2 to 4 servings of whole grain, 5 to 7 servings of fruits and vegetables, and 2 lean proteins.
That is correct. So I think that you understood all of the information presented, and I will talk to you later about it all.
Okay, thank you, Scout Morrison.